Welcome to Mom in Mind, where we dive into all aspects of perinatal mental health and wellness related to pregnancy, birth, loss, postpartum, and new parenthood. It's so much more than postpartum depression. We raise the volume on all of these topics in the hopes that someday everyone will have the support and info that they deserve before they need it. Please note this podcast is not a replacement for treatment by a professional or professional training. Welcome to Mom in Mind. I'm your host, Dr. Kat. In today's episode, we are going to be taking a closer look at some of the cultural aspects of maternal mental health for Asian Indian mothers. We're going to talk a little bit about how maternal mental health issues might present or what some of the barriers might be to accessing and receiving perinatal mental health care, and also what are some of the strengths of the culture that are supportive of perinatal mental health. We're going to hear from Dr. Deepika Goyal, who is a professor of nursing at San Jose State University and a family nurse practitioner who's passionate about maternal mental health, specifically among women of Asian Indian descent. Dr. Goyal's research adds to the postpartum mental health narrative regarding Asian American women's experiences, mental health help-seeking behavior, and preferred management of postpartum depression. Her research findings provide clinicians with information they need to provide culturally informed care to promote optimal maternal-child well-being outcomes. I really love getting into these discussions about how culture shapes our experiences through motherhood and very specifically through issues regarding perinatal mental health. So let's meet Dr. Goyal. Welcome, Deepika. Thank you so much for being with us.
Well, thank you for having me on the show.
I would love to hear about your work. I'm really fascinated by what you do. So if you can start there, that would be great.
Okay, so my research area centers around postpartum depression and associated factors such as sleep disturbances, infant temperament, marital satisfaction, all the social support, all of those kinds of things. So the population I focus on is Asian American moms, in particular Asian Indian women, so women of Indian descent. Mm-hmm. And as a young Indian mom myself, I experienced some depressive symptoms after the birth of my first daughter. Mm-hmm. And so, kind of got through that episode, wasn't really sure what was happening to me. Then fast forward about 10 years later, I was doing my master's degree in nursing, and I was reading some articles about, women in a support group who were going through postpartum depression and the feelings they had. And I realized at that time that that's what I was going through years earlier. Mm-hmm. But I never really knew what was happening. I couldn't put any words to it or describe it. It's just something I got through.
Sure. Yeah.
And so for my master's project, I decided to look further into phenomenon of postpartum depression and specifically in Indian women. So that's kind of how I got started in this research area. So from my own personal experience.
Sure.
And so it was just interesting in looking at the literature. There really wasn't anything about postpartum depression in Indian women in the United States at all. There was lots of research conducted in India and Canada and the UK, but primarily with low socioeconomic groups.
Okay. And
nothing really in the United States. It was something that was kind of intriguing to me. Like there's this thing called postpartum depression. These are, women are talking about being isolated and feeling like they're on a roller coaster and not really understanding what's happening to them. And I wanted to examine it further. So I, conducted a small study looking at depressive symptoms in women in Northern California. Mm-hmm. And, women answered my survey, which was great. And of the women that answered, more than half of them had high depressive symptoms, so they were at risk for developing depression.
Oh gosh, so, that's a high number.
Yeah, it really was, considering it's very, in general, depressive, mental illness, depressive symptoms are very stigmatized in the Asian cultures, in all of the Asian cultures actually. And I do recall back when I first read this article in graduate school about postpartum depression, and I kind of, talked to my parents and talked to some family members, like, so reading about postpartum depression, have you ever heard of it in Indian women? And everyone's like, oh no, Deepika, you have a good husband, you have a child who's well, we don't talk about mental illness, not something we talk about. Yeah. And so, yeah.
Okay, so just in general, for Asian Indian women, postpartum depression is not highly recognized?
It hasn't been. Okay, so back when I started my research, we're talking, 2001, 2002, when I was in grad school. So back then it was something nobody was really talking about. Really, maybe you heard some things on the news. Typically on the news, you would hear about the women who had the most severe type of postpartum depression. There's a kind of a continuum, postpartum mood disorders or postpartum mood and anxiety disorders. So it goes all the way from anxiety to the blues. Blues, 80% of women have the blues, kind of up and down symptoms that they resolve on their own. But about 1 or 2 of every 1,000 women have postpartum psychosis, those are the things you hear about in the media, where women have jumped off of a building, or they've hurt themselves or their infants, or they've killed themselves or their infants. And so back in 2001 and 2, people only thought of those most tragic stories or those incidences, not depression. And so over the years, ever since I've been looking into, studying this area, it has become more mainstream. And there's more policies that are addressing this. It's become, more awareness. So I think it's kind of coming over into the Indian community, but not as quickly as in mainstream cultures.
Do you have a sense from what you've researched or what you've heard, how are postpartum mental health issues viewed in the Asian Indian community?
Well, I think listening to women tell their stories is one thing. So in general, it's still kind of hidden. So in the older generations, it's something you don't talk about as much, especially with people outside the family. Within the family, they will, obviously try the best to help. But typically, I conducted several different studies, and one of the studies was in particular talking to women after they've had a child, within the first 12 months after having a child, and trying to understand their thoughts about what do they think postpartum depression is, or do they know what the symptoms are, and who would they talk to if they felt like they needed to talk to someone about any symptoms of depression. What did their friends and family think? What did they think? And in general, they kind of knew somewhat what it was, and they would talk about if they had symptoms or they felt like something was not quite right. They would talk to their spouses first, but they would only go in for help as a last resort.
Okay.
And some of the women said they didn't really know what the symptoms were, so it was all kind of a little bit all over the place. But in general, there was still a lot of fear of family finding out, or someone outside the family finding out, like bringing shame to the family, or women feeling that they would not be seen as strong enough to handle what they were going through.
Okay, so shame in the family, kind of being seen as weak or having some sort of weakness.
Right. And, we're also concerned about even having their insurance companies know that they will have a diagnosis of some kind of depression.
Right. Well, I wonder then, if you saw from your research, how did maternal mental health, perinatal mental health issues show up? Like, what was the presentation? Does it show up in physical symptoms or some other way?
So first of all, just kind of off the record, I didn't really examine that piece per se.
Oh, okay.
But so the research was more about talking to women about what their thoughts were. So it kind of, if I could just go back a little bit. So the first study back in 2001, 2002, that was looking at self-report symptoms, right?
Oh, okay.
Like women would anonymously fill out a questionnaire. The first research study that was published in 2006 was looking at Asian Indian women's self-report of postpartum depression symptoms. So, they filled out an anonymous self-report questionnaire. So that indicated that more than 50% of the women was scoring in the high depressed range, or a high risk for developing depression. And then a few years later, I did some medical record review at Palo Alto Medical Foundation, or I should say a clinic in Northern California, perhaps. And in that, what I was looking at, what were the clinical diagnosis rates for women of Asian descent? And what we found there was, for clinical diagnosis rates, Asian Indian women and actually Chinese women were significantly less likely to be diagnosed with postpartum depression compared to Caucasian women. And so there was kind of a disconnect in my mind that self-report symptoms or rates were high.
Right.
Clinical diagnosis rates were low. Right. So then, makes you think like there's some disconnect. So then I kind of started on this pathway of talking to women, to wanting to understand what their understanding was of postpartum depression, and, what would they do, and who would they talk about it in their families? Like just trying to understand. Because as a nurse practitioner or, in the medical field, you really need to engage the whole family for treatment in certain circumstances, such as, in order for women to obtain help, you kind of need to understand the whole family dynamics.
Yeah.
Because as you might know, in the Asian cultures, often the mother-in-law or a female relative may come and stay with the new mother for an extended period of time, 3 to 4 months. And so they're part of that family dynamic with all the decision-making that happens.
Sure, making decisions collectively.
Right. So in that qualitative research, in talking to the women, what we found is if they did have symptoms, they may or may not know there were symptoms, but if they knew they were having some kind of symptoms or they weren't quite feeling quite right, they would definitely talk to their spouses first.
Mm-hmm.
But the thing that was the most striking was they would not go in for treatment until it was the last resort.
Mm-hmm.
So that's the piece that's actually concerning as a clinician, because, if they go in earlier, if there's intervention sooner, we can kind of maybe the piece about the intervention was the problem, I believe, in talking to the women, because they were very much against antidepressant therapy or pharmacologic therapy.
Mm-hmm.
And instead they were seeking alternative or complementary medicine, right?
Sure.
And, these days with the medical system, there's just not as many practitioners of alternative medicine that are also specialists in postpartum depression.
Right. Very slim pickings there, yes.
Right. So I guess the issue is they may have the symptoms, they'll tell their spouse, but knowing if they go in for help, there's only really, most commonly is pharmacologic therapy, and they weren't really interested in that. So therefore, they would wait till, in this sample of women that we interviewed, collective thinking was that they would wait until the last minute to be seen, which then kind of promotes that presentation in a psychotic state sometimes, right?
Right. They've been suffering for some time, just trying to keep it together.
Right.
Okay. Mm-hmm.
And, there was a lot of stigma as a barrier to obtaining mental health care. If they were going to seek it, they wanted to seek it anonymously.
Mm-hmm.
There were thoughts about feeling that it was a personal failure for needing mental health care, And I would just say again, the most striking finding was that they would seek professional mental help, but it would be as a last resort.
Would this be more along the lines of like psychotherapy, or at that point seeking medication?
Yeah, so actually, thank you for bringing that up. So basically the whole thing about therapy and medication was not really something that was accepted.
Oh, okay.
Right.
So they're still searching out for a complementary medicine, but at the last moment. Right.
But I mean, overall, it was good to see that women would seek help at least, at some point along the way, even though it'd be at the last, as the symptoms got worse, they would eventually seek help. That was good, because in the past, hearing about it, anecdotally from family and other friends and family, it would be something that you just wouldn't talk about.
Mm-hmm.
Right.
I was wondering if, and maybe this is a side question, if in your research was there any differentiation between like first generation Asian Indian women versus people who maybe had been here longer?
Right. So the women who had been here in the United States, that were more acculturated to the Western culture, they were more likely to seek help.
Mm-hmm.
So it's interesting. So, the family members that come to help for the 2 to 3 months or 3 to 4 months after the new baby, they're really good social support the new mother and the new family, but they can also, kind of hinder seeking mental help.
Oh, right.
Because you were talking about the generational differences and the values.
Oh, right.
But I think overall, I believe we are moving forward. So things have moved, even over the last 15 years or so, things are, they're a little bit more accepted.
Like conventional Western medicine type of?
Knowing that if you need to get help, it's okay to go and talk. I think people are more open to now going to seek therapy or, psychotherapy. I think antidepressant therapy is still something that, we need to work on.
Mm-hmm.
But that's also where my research has taken me, is looking at sleep disturbance.
Yeah.
So I think as healthcare providers working with childbearing women, we can let women know that they need to get good rest after they have a baby, right? And they may need, if their symptoms are warrant, they might need pharmacologic therapy, and that's okay. But also if they can do some things that, when the family is there helping them with the new baby to get enough sleep. The researchers suggest that women who get at least 6 hours of uninterrupted sleep have lower depression scores than women who don't get 6 hours of uninterrupted sleep. And of course, as a new mother, they're going to laugh at that. Like, well, how am I going to get 6 hours of sleep?
Right.
But, getting, okay, try with 4 or 5. Have a family member give the breast milk in a bottle if you're breastfeeding. Have family kind of help with the care of the child as well.
Right. To extend that sleep. I wonder, and maybe I'm kind of going down a different pathway here with this question, but I'm curious if there are like culture specific practices that are supportive and or if it's hard to access those types of practices here that would be supportive. Does that make sense?
I believe so. So the biggest culture-specific tradition in the postpartum is having a female relative. Typically, it's the mother, the new baby's grandmother, or so basically the mom or the mother-in-law or a sister. Someone comes to stay with the new family for 3 to 4 months and kind of takes over the household duties, right? The cooking and the cleaning, so that the new mom can bond with the baby and take care of the baby's needs. And for many families, that's not possible, especially if they're here and their parents cannot travel, or, I don't know how you say it, if there's immigrated or emigrated, but if they've, they feel many families here are isolated from family back home.
Sure.
Right?
Yeah.
The thing about Indian culture is there are many subcultures within that.
Yeah.
And in all the Asian cultures, there's about having 30 to 40 days of rest at home, where somebody can take over the household duties or, not leaving the house. So those kind of, not leaving the house is not practiced as much in the United States because people have to go out to visit physician appointments but basically women may not follow that as strictly as they might if they were back in India.
Sure.
But the main cultural practice would be the, remaining indoors for 30 days, without going outside. It's more so to prevent illness for the baby because they haven't had their immunizations yet, keeping the new mother warm so she heals properly. And as I was saying earlier, even within the Indian culture, there are many different subcultures and each of them have different, same kinds of dietary modifications for improving breast milk production and healing. However, each subgroup might use different herbs, but they're all aimed at breast milk production, like fenugreek seeds are very much help with breast milk production and healing, just to heal the body after having a child and keeping warm. I mean, you'll see women wrapped up. Their body is thought to be in a cold state after having a baby, right? So they want to heat, warm you up again. And you'll see new mothers will get special foods that are rich in fat and nuts and things that will help you heal.
For you, the listeners of Mom and Mind podcast, Audible is offering a free audiobook download with a free 30-day trial to give you the opportunity to check out their service. Some of the books I've listened to from Audible are Daring Greatly by Brene Brown, You Are a Badass by Jen Sincero, and Down Came the Rain by Brooke Shields. You can pick one of those books or any other book you'd like to listen to. To download your free audiobook today, go to www.audibletrial.com/momandmind. Again, that's audibletrial.com/momandmind for your free audiobook. Right. So if somebody has access to that type of support and or those types of foods, I'm assuming that would, maybe we don't know, be preventative, but certainly could potentially be preventative.
Preventative for
developing a mood or anxiety disorder.
I'm not sure if it's the actual items of food or support. I don't think it's the actual food. I think it's the feeling of support. I mean, I think that's kind of something that's not necessarily expected, but that you see done in families where someone has a new baby and, everyone kind of gathers around to collectively take care of the needs of that new family. In my own case, I had my first child on a military base in Japan in the middle of winter. And nobody came to stay with me. So in answer to your question, I really think maybe not at that moment, but I did kind of feel isolated and neglected. But I can't say that contributed to my depressive symptoms because at the time I didn't know I was depressed.
Right.
Nobody ever asked me how I was feeling. All the medical appointments were focused on the baby. And so, but the reading stories later on, reading research articles later on, specifically kind of a classic research by Dr. Cheryl Beck, where she talks about the lived experience of postpartum depression. And reading those stories, she interviewed women who were part of a postpartum depression support group, and hearing them talk about how they felt, that really struck a chord with me. And I realized that that's what was happening to me earlier with my own child. But it wasn't until then that I knew anything was wrong. I knew there was something wrong with me. Even my husband knew there was something going on, but he couldn't really there was nothing we could really do about it.
Right.
So we got through it. So I think the family support, knowing that all of my other cousins and family members had someone come and stay with them.
Yeah.
Yeah.
Sure. And then there's this other piece that I keep hearing over and over about not having just the information about the potential of these feelings and how you could feel, and not you specifically, but certainly all women, that certainly there's not enough of us talking about it for everyone to be aware that this could happen just from the information point of view. But then there's also this long history of stigma around these feelings in general. So there's no context to understand why you feel the way you feel.
Right. So I think things are changing slowly. And that's why I'm a family nurse practitioner, but I work with women's health, childbearing women. I see a lot of pregnant women. And I think as clinicians, we need to be talking about potential for mood disorders during the pregnancy. And talk about what are the common types of feelings like the blues, and then when to seek help. When those symptoms get severe, or if those symptoms aren't going away, that's when you need to get help. So the conversation has to start during pregnancy. We can't be waiting until after.
Oh, yeah, absolutely. I know you've started your research with Asian Indian women and have branched out to all Asian women. I'm curious if you're seeing some similar patterns, if there are some cultural similarities.
Right. So after talking to the Indian women in collaboration with other colleagues, we've done similar studies talking to Chinese women and Vietnamese women, and are in the middle of wrapping up a study with Korean women, just to kind of understand, because much of the research that has included Asian American women in the study samples, they'll have like one Chinese and one Indian, and or two Indian, and that kind of mixed in with everyone else. It's not separated out. So just curious, are there differences? There are slight differences there are differences in the traditions, the perinatal traditions, but the postpartum care is very similar. The postpartum traditions are very similar. Staying indoors, the time differences slightly vary from 30 to 40 days, but the period of rest after a new child, staying indoors, the family support for the new mom, the food. So again, everyone feels that the pregnancy is a hot state, but after the baby is born and the blood loss and all of that the body is now in a cold state. So everything is done to kind of keep that body warm for healing. But each different group has slightly different food items, broth versus different types of food for each group, but the principles are the same.
Right. So, and then obviously your sample of people you're studying are here in the United States. The same thing would be true too, that sometimes the practices that may be supportive could be harder to access because the support's not there.
Yes, definitely.
Yeah.
Yeah, due to family not being there. But there are now companies that, not for Indian families as much, but been hearing about companies that will come and they'll provide you the food that they have, like packages. Nowadays with the internet and free commerce, there's companies that will come into the hospital and bring you your postpartum meals. Like kind of food service, like we have, all the different cooking services now for food, like HelloFresh and I don't know the other ones. But now there's also postpartum support services like that.
That are culture specific?
Yes. So in the hospital, you'll see the fridge they've got like Chinese broths. And, and actually, interestingly, the Korean study, we're still analyzing the data, but in Korea, there's actually like a postpartum doula that some women might access here. A person that comes to your home and kind of helps you through the postpartum period. That in Korea, where there'll be a woman that comes to your home and helps you with breastfeeding and helps you with all the care, kind of get you through the postpartum period. So it's very interesting, all the different traditions and practices.
Sure. And as you're talking through, I'm thinking, obviously, I guess from a therapist perspective, because that's the work that I do, is if I were meeting with an Asian Indian mother or an Asian mother who is maybe first generation, like, how could I support them? What could I do to make sure that, if they were coming in to meet with me, how best could I support them in their healing process?
I think just listening first, which I know you do very well. I think I'd need to know more about what you did. That's kind of off what we're saying. I don't know how to say pause or whatever, but I mean, as a therapist, I think it's important to keep an open mind. And be aware of all the culture specific types of practices and traditions to kind of assess your clients to see, how they feel about those practices, and to kind of how I did with my research, so trying to find out if they missed that, or if there are these cultures, did they have them, or if they didn't have them, how did it make them feel, and kind of trying to understand, what is contributing to the depressive symptoms.
Sure. Yeah. So we're not making assumptions then about, I heard that from your culture, this is what's used, so that's what you should do now. Right. Because people, especially people who are acculturating and in the process of acculturation, there could be many different stages of what feels supportive and what doesn't.
Right. So just the simplest thing, as a nursing instructor as well, and students come to me, do we give they have an Asian patient in the postpartum unit, and it's, do we give them water with ice or without ice? I don't know what to do. I said, why don't you ask? Just simply ask the patient what they would prefer.
Right.
And, but that was good that they were aware that in general, Asian cultures, they may not like ice, but just check. But that does speak to even putting ice on the perineum, right? To kind of help with swelling, that they might not want that because the body is now in a cold state. It would be counterintuitive for them. So again, trying to explain the healing benefits of that and why we would use ice. And if they don't want to use it, then that's fine.
Right.
We would, respect their wishes.
Yeah. I think that's great advice, both for, I'm thinking of the therapists or clinicians or healthcare providers who are listening. Really, I'm going to drive home that point again, is to not make assumptions. And I love that. Yeah. Just pose the question to them. It's great to have the background knowledge, but you're also dealing with an individual. And that sounds very, very imperative.
Right. I'm happy to share some links or some citations of the work I've done if people are looking for more information.
Sure. I would love to do that. I can include those in our show notes so people can look up your research. That would be fantastic.
The specific articles regarding the Indian women and the Chinese and Vietnamese women.
Oh, fantastic.
Yeah, I think in general, because I know you add some things as well, in the Asian Indian culture overall, mental health is still stigmatized. Okay, but we have to kind of talk about it in terms of it's for the infant health as well. So we kind of can reframe it, even though along those lines, if we can improve how the mom's feeling, then that baby's going to be the beneficiary of that.
So then kind of taking some of the focus off, mom, you need to get better, to more on the collective, that this is bringing it back to the bigger system of the family.
Right. So, babies of moms who are depressed, are going to smile less, right? They might not be as ready for school as other children because that interaction, that bonding with the child, the talking to the baby, all of those things, if the mom is not able to do those things because she's feeling depressed and just doesn't want to deal with it, then, all of that can affect the baby. So the maternal-child bonding can be disrupted. So maternal-child bond can be disruptive. Their cognitive and language development can be affected. So there's many things, so, goes on with babies of depressed moms, maybe not get all of their health checkups on time or their immunizations. And, there's a whole another path of research findings about that.
Sure. So if we are in a position to be supporting an Asian Indian mother, I think from what you're saying is that we can bring in the benefits of taking care of herself and how that benefits the child and the family.
Right.
That message is maybe a little bit better received than you need to focus on yourself.
Right. Yes. It's more about the collective versus the individual care. And that's how Asian cultures typically are. It's more about the group versus the individual. So that might, one way to kind of support the mom.
Sure. And what have you seen in terms of, people, I don't know if this is in your research, but people who have have kind of found out or realized that, yes, they are dealing with some type of depression or anxiety and gotten the help. And I'm kind of wondering what kind of hopeful messages you have for people who are navigating this.
It's an interesting question. I actually don't know, to be quite honest. But from talking to the women, the fact that they would go and seek mental health help if they needed it, that was very promising right there.
Sure.
So just them acknowledging that, yes, if the symptoms got bad enough, we would go and seek psychotherapy. We would do what we needed to get better.
Okay, right. So there's like a high level of tolerance of kind of feeling unwell. And then once they get to a point, they will go and get the help they need, potentially. Right. I mean, that's, I think, one of the fascinating and maybe difficult parts of research is that, like, you are meeting and talking to families and mothers, and then you don't really get to have the follow-up.
Right.
How did things turn out?
Right. Yeah, so from my point of view, I've wanted to understand this phenomenon more in Asian Indian women, and then I'd really like to do some kind of intervention, so non-pharmacologic intervention, kind of tailored at getting babies to sleep, because a lot of my PhD research focused on sleep disturbance, as I mentioned earlier. So, we have to do something, and if women aren't receptive to antidepressants, then maybe, we can always try the non-pharmacologic treatment as well.
Yes.
So in general, all of us should be getting enough sleep, but especially after having a new child or a new baby, that sleep is very fragmented. So it's not the amount of sleep, it's the fragmented sleep.
Yeah.
So if you're sleeping for 4 hours, but you're waking up every, 20 minutes because you think you hear your baby cry, that's still fragmented.
Yeah. Right. And then, wow, that just can go downhill really quickly in terms of your ability to just kind of get through the day without that sleep.
Right. But there are other organizations for help for, all women, and including Asian women. So that definitely Postpartum Support International has people, volunteers who speak all languages to help. So that's Postpartum Support International. And then I know there are some other programs directed at mental health, and I can send you some links if you want to put them at the end.
Yeah, that would be fantastic. I will take any resources that you have. Yeah. I know that people are hungry for that kind of thing.
Right.
We need to spread this information. Well, I thank you so much for all of the work that you do and coming on to share with us your research and your experience. I'm really hopeful that people who are listening will have learned something new today and will be able to help other moms.
Thank you very much for your invitation.
Thank you again, Dr. Goyal, for being with us. I really hope that everyone who's listening can hear these takeaways and really, again, being conscious and aware of how culture might be impacting either your mental health and or if you're a provider, the mental health of the people you are supporting. There are so many different ways that culture can both impact us and strengthen us in our recovery and healing process. If you are new to the Mom in Mind podcast, please subscribe and share this podcast as far and as wide as possible so that all new parents can get this information that they deserve before they need it. Thanks for being here. Until next time. Thank you so much for joining us today. Please share this podcast. Together we can support moms and families so that no one has to deal with this alone. Come connect with us at mominmind.com.